Hello guys, this is Unique and I'm Hitakshi. Today I'm going to tell you from where, when and how the coronavirus started and it gripped people continuously. And also I'm going to tell you about the private and public healthcare facilities in India and the second wave of COVID-19. On the 1st of December 2019, a man was admitted in a hospital in Wuhan, China. By the 11th of December, about 200 people were infected with the virus. Doctors at Wuhan Central Hospital took a sample from the patient's lungs. They sent it division medical test, and within the 48 hours the company get to know about the virus. Till 30th December, about 11 million of people have lost their lives, and the first lockdown in China was on 23rd of January, and it's too late. Between 30th December and 23rd January, it comes the Chinese Lunar New Year. The world's biggest human migration takes place during the Chinese Lunar New Year. The Chinese Lunar New Year basically supercharged the virus. Chinese people made about 450 million trips this year. 5 million people who were possibly infected left the city, and that's why the virus spread like fire. As I said that about 5 million people who were possibly infected left the city. So obviously the places there they went, the virus has spread there also. So about 20 cities were infected by the virus. Actually, if I'll tell the whole 20 countries where the virus was spread, so the video will be too long. So I'm just telling the common countries where the virus was spread. So they were namely Taiwan, Japan, Thailand, South Korea, Singapore, Malaysia, Australia and Indonesia. India was also one of the 20 countries where the corona was spread. On January 27, 2020, a 20 years old lady was infected and admitted in a Thrissur hospital in Kerala. Till the end of the year 2020, there were total 30,279,331 cases and 396,761 deaths. Now you can imagine by the report that how much the people have suffered. In the first wave, there were about 98,000 cases in a single day. Then the cases dropped down, and in November, December, January and February, the cases were medium, or you can say low. Then in March, the cases suddenly increased, and this was the second wave, and the condition was 1 lakh cases in a one day. By seeing the report, we can say that the second wave is more dangerous than the first one. And also, in this pandemic, the healthcare workers like doctors, nurses, and all the medical staff and scientists have played a very important role in our lives. Both public and private healthcare centers tried their best to save lives of people. Yes, in the private hospitals, the cost was so high that it can't be easily paid by a common man. But their facilities were also good. And in the public healthcare centers, the cost was not so high. It was medium, or you can say low, but their lines were so long. The public healthcare systems and hospitals gather the funds from the government, which makes it mandatory for them to cater to everyone. Everyone first prefers the public sector, but after standing in long lines, many of them choose to private healthcare. Now the cases are decreasing, but we have to follow the safety measures to not let the third wave come. Thank you all for giving your precious time and watching my video. In this video, I'll not say you all to like or subscribe it, because the motive of making this video is to just spread awareness among you all. So just share my video as much as you can, and if you want to like and subscribe it, you can. Unique Vision, dream to empower India.